So Jody, I'm going to go ahead and, my name is Mark Pfister. I'm with the Lake County Health Department, and so I'm going to have you go to slide 3. Yes. So one thing that Aaron and many of the speakers have talked about today, and I'm going to talk a little bit about health outcomes. So it's really this box over here to the left. And so a lot of times when we talk about the populations that we serve, homeless or diabetics or what have you, is that they're really, when we're looking at diabetes or we're looking at homelessness, those are all dependent variables of the independent variables, that there's other things that are driving these individuals' life course. And I think when we really think about our policies and interventions is that they all cost money. And so I'm going to have Jody go to slide 6, I believe. 2 more. Yeah, go through that. And actually just stop at this one real quick. But I wanted to say, when we are talking about individuals that have behavioral health issues, is that you can see that this is state of Illinois. Medicaid members with diagnosed and or treated behavioral health needs make up 25% of the population of Medicaid, but they're 56% of the total spend. So usually what we have when we're having somebody that has mental health or behavioral health issues, that these are very costly individuals, which is something that we really need to think about when it comes to funding. So here, who here knows about the Section 1115 demonstration waiver for the behavioral health transformation? Okay, so some good hands. So just on September 2nd, the state of Illinois came out with the behavioral health transformation. So there was a public hearing down in Chicago on the 9th. And really what that is that the Social Security Act allows for waivers to states to determine how they're going to potentially fund Medicaid. So what they've decided as a state is that behavioral health issues are really very large and very costly to the Medicaid system. So I'm actually going to have you go to the next slide, is that if you look at the costliest 10% of Medicaid behavioral health members, they account for more than 70% of all the behavioral health spend. So pretty much every dollar that's being expended, 70% of that is just for 10% of that population. Next slide, please. And so some of the other issues that really come down to the getting to the health outcomes that we need to reduce the costs to our Medicaid system is that you can also see that behavioral health Medicaid members are 3.5 times as likely to have a chronic condition and almost 2 times the spend of non-behavioral health populations. So when we're looking at individuals that are homeless or that have other issues, is that it's usually not just one issue. It's not just substance abuse. It's not just that they're probably a tobacco user. They probably are involved with IV drug use or other issues that get into sexual encounters that may lead to HIV. These individuals also may have diabetes or other comorbidities or other conditions. And so the cost of these individuals to the system is very high. But before we even talk about giving them health care, is that they need to be stabilized. I mean, so we've heard a lot about today is that if I don't have a home, if I don't have food, am I really going to be listening to my physician for 15 minutes tell me that my A1C is high? I mean, is that something that we should expect? I mean, so this is where those independent variables are really what we need to address. So if you haven't looked at the Section 1115 demonstration waiver, please do. Just go to the 2 more slides. So this is one that I wanted to talk about just briefly, is that Medicaid enrollment has grown in the state 4% on an annual basis. But this box here, and this is where Mark and I were talking earlier, that really the devil's in the details of this Section 1115, is that you can see this transition from Medicaid to now managed care. All right, right now managed care in the state is in a state of flux because the state did not standardize the process how managed care companies actually work with the different providers such as the health department. So there's a lot of variation. It has cost us a lot of dollars to administer or to go back on claims that may be denied or other issues that go along with managed care. So with this being said, is right now managed care in the state is more as a gatekeeper. We're hoping that Section 1115, that there's more of a commitment from managed care organizations to really make the health outcomes change, because the better the health outcomes, the lower the cost. And I think I'll just leave this with the last slide, that these are the 6 overarching goals. The Section 1115 waiver is about 88 pages. There is an 8-page summary, so I'd suggest reading that one first. These goals are on there. But I also wanted to give a shout out is that this just came out here in September, but also in November 2015. And I want to thank Ernest Vasseur and the Healthcare Foundation of Northern Lake County. We do actually have a behavioral health plan for Lake County, which you can go to the Healthcare Foundation of Northern Lake County website. It's right on their front page. Please read that, because actually many of the goals that are in the Section 1115 request to CMS is actually the goals that we have already identified and are working on since November 2015 here in Lake County. So what I would like is for everybody here in this room, right now it looks like the Section 1115 is a good way to help us all move forward with where we need to go. So thank you.